Everyone, my name is Derek Marsh, and I am the Associate Director for the Global Center for Women and Justice. I'd like to welcome you to Plenary 3, Hope and Resilience, addressing the challenges for substance abuse and mental health. Before we get further started, I'd like to introduce you to Natalia Abarca. I knew I'd mess up your name. I'm sorry, Natalia. I'm going to try one more time. Natalia Abarca, and she's going to discuss with you our translation and interpretation services and give you some instructions. Natalia?
Thank you so much and good morning. Today we're going to be providing interpretation services. So I'm going to give this message in English and then I'm going to move on into Spanish. So for computer users, please click on the glove at the bottom right of your screen and select English to listen in English. If you're using a mobile device, if you're using an Android or an iPhone, please tap on the three dots that says more and select language interpretation. You're going to be selecting English and then tap on done. The interpreting feature is not available in Chromebooks or in older computers. My name is Natalia Barca and I'm going to be working today with my team, Jorge Ibarra and Stephanie Rock. Mi nombre es Natalia Barca, soy intérprete del Departamento de Educación del Condado de Orange. Voy a trabajar el día de hoy con mis colegas Jorge Ibarra y Stephanie Rock. Les voy a dar una información acerca de cómo utilizar la herramienta de interpretación en Zoom. En la parte inferior de su pantalla usted va a ver un globo terráqueo. Allí por favor haga clic y cuando usted vea la palabra español, hace clic en la palabra español para escuchar con el mensaje. Para los usuarios que tienen dispositivos móviles, cuando se encuentre con los tres puntitos, haga clic allí y va a seleccionar interpretación en español. Lamentablemente la interpretación no va a estar disponible si usted está utilizando un Chromebook. Thank you so much and we are good.
Thank you, Natalia, and again, apologize for butchering your name like that. I want to thank everyone for joining us today. I hope you had a good lunch. I want to welcome you again to the Hope and Resilience, addressing the challenges of substance abuse and mental health. I'm going to be your moderator for today. Again, my name is Derek Marsh with the Global Center for Women and Justice. I would ask that you please keep yourself muted throughout the presentation today. If you need to have, we would love you to question our panelists. If you, in your lower right-hand part of your screen, you'll see Q&A, and we'd ask you to put your questions there for our panelists. We are great panelists. We've had them multiple times here at the Global Center for our Injured Justice, and they've been greatly received each time. And you're going to have a unique experience today because they're going to jointly present, which is unique and great. I think because you're going to get both their perspectives, and it'll be, you won't have to worry about like 15 minutes of this, 15 minutes of that. You get the full presentation together with them. If you have any problems with technical issues, please message in the chat. And while I may not be able to help you, I'm sure our technical staff will, and they'll get going on it. I would like to introduce right now, though, and move forward with our presentation. First, Stephanie Lasco. She's our program specialist of youth development programs at the Orange County Department of Education, and Stephen Lambert, who's a prevention coordinator at Orange County Department of Education. They are great people with great insights into this issue. And without further ado, I'd like them to start their presentation.
Thank you very much, Derek, and good morning, or good afternoon, everyone. Buenas tardes a todos. Let's begin. So our presentation today is called Hope and Resilience, addressing the challenges of substance use and mental health, because we really wanted to examine these risk factors that create a number of vulnerabilities and interact with a lot of the risk factors around human trafficking. And today, I just wanted to start by giving, again, a little more context. Stephanie and I both work for the Orange County Department of Education. So you'll notice sort of our context here is working primarily with youth. So sort of in that CSEC context, we understand CSEC is not the only form of trafficking. And so we're hoping that for you, you consider your own context, the way that your work fits into this, your experiences, and finding kind of the right questions that you need to ask to seek data and to seek answers for your own communities and your own context. But here are the topics that we're going to be talking about today. We'll start by discussing how mental health and substance use are risk factors for human trafficking and how they interact. Second, we'll talk a little bit about how the COVID-19 pandemic has started to affect and shift some of these risk factors. And finally, provide some resources and strategies for building resilience and protective factors among young people so that we can address both of these issues. So let's begin. In talking about some of the risk factors for human trafficking as were addressed earlier today, so I'll touch lightly on a few of them. Broadly speaking, social isolation, trauma, and economic hardship are really some of the key high-level risk factors that create vulnerability to human trafficking, broadly speaking. When we look a little bit more closely at some of the factors that fit into them, you'll see some familiar things here from the presentations today from Pam and Nicole. So social isolation, trauma, and economic hardship, but these cycles that you see of substance use and mental health disorders, family, peer, and dating violence, which then interact with marginalization. So let me explain really quickly. All of these things very interrelated. You can see how the cycle of violence is related to very often familial substance use, and then can create substance use disorders and mental health disorders in young people as they grow. All of this wrapped up in trauma and ACEs. And let me discuss briefly the marginalization piece as well. So when you look at young people, particularly who are in trafficking situations, you'll see overrepresented, as was mentioned earlier by Pam and Nicole, foster youth and LGBTIQ plus youth, homeless youth, and very often these demographic categories will overlap because LGBT youth will often find themselves homeless due to familial discrimination. Sorry, excuse me. So anyways, a lot of these intersecting vulnerabilities here create more barriers to leaving the life, and all of these cycles interact. But we're really going to focus in ourselves on these substance use and mental health disorders aspects. So in order to sort of visualize this, we split it into these two columns about how these things relate in terms of recruitment as well as means of control. So you'll see over on the left-hand side, when it comes to recruitment, there's exploitations of individuals who have these pre-existing mental health conditions, cognitive disabilities, and folks who are dealing with a substance use disorder are more vulnerable, particularly when you look at the intersecting populations, again, youth experiencing homelessness, a history of abuse. And the second item there you'll see is access to substances. So having difficulty obtaining substances to feed when you have a substance use disorder then leaves you vulnerable to recruitment by providing substances as an incentive. And then the third item there is relief from economic hardship and housing insecurity. So as you might imagine, substance use disorders, mental health disorders, they can create a lot of economic hardship. It is hard to maintain employment, and substances can become expensive, which can then lead to things like survival sex. And then finally on the left is trafficking of partners or family members, which is quite tragic. And that can occur sometimes in order to continue to support a substance use disorder, to purchase the substances. Now over on the right-hand side, you'll see the means of control. So the first item there being dependence and withdrawal. So once you have a substance use disorder, it can be harder to leave due to the addiction. You want to avoid the dependence and withdrawal from the substances. So once the trafficker has been able to provide you with those and you are addicted, it's harder to leave. The second there being the drug debts and limited employment prospects. So this sort of comes back to what we mentioned earlier, which is if you have been supplying this survivor with the substances, then you can become indebted. And it becomes a question of who's going to hire you. If you leave here, how are you going to get a job? Maybe you have criminal convictions, all sorts of barriers. Illegitimate treatment homes, this applies to both substance use and mental health. There are cases of labor trafficking in what are supposed to be safe recovery homes for individuals taking advantage of their situation and vulnerability to pull them into a trafficking situation. And then finally, this is a big one, and this is really a social issue, is the believability and the increased social isolation. So the disease of addiction really manifests itself in hurtful actions very often, and it can alienate individuals from their friends and family. And so they become more isolated and they lose this perception of credibility. So who's going to believe you if you go to your friends and family for help? They're never going to believe you because they think that you tell them lies. So it's really quite tragic to see some of these cycles playing out. And you can see how mental illness and substance use really interact throughout these risks and throughout these factors. But let's move forward. What I'd like you to do, actually, if you wouldn't mind, is in the chat, if you could post in your own experience, again, trying to connect this back to your lens, how have you seen these factors interact and contribute to human trafficking even before COVID-19? So based on some of the things that we just discussed about substance use and mental illness as factors for recruitment, as factors for means of control, how have you seen that play out in your experience? And then hopefully all of us who are viewing the chat can see some examples of that as we move forward. So as you are entering those items into the chat, we'll move on and talk about a shifting landscape here. So how have the risk factors that we have been discussing been affected by the COVID-19 pandemic, which has touched so many aspects of our lives and our existence nowadays? What I'd like to do is to, and I've done this before in a different variation, do a little prediction activity with you all. So briefly, take a look at these two indicators. And what I'd like to see is if you have a prediction that you'd like to make around these two. So I want you to think for youth tobacco and e-cigarette use, do you think during the pandemic that increased or decreased? Do you think more young people using tobacco and e-cigarettes or fewer? And then the second, for youth opioid overdose deaths, do you think that those increased or decreased during the pandemic, during the COVID-19 pandemic? So just think about that. You don't have to put it into the chat, just for your own kind of personal reflection and prediction. Give you a second to think about it. So if you answered that youth tobacco use and vaping went down, but youth opioid overdose deaths went up, you are correct. So let's take a look at the data here and substantiate that item. So the first here is looking at tobacco use among high school students. And notably, you'll see here the e-cigarette, and I understand that the text on some of these is smaller, so that's why I'm going to highlight some specific things. The e-cigarettes right there in the fourth column from the left is showing a sharp decrease in use between 2019 and 2020, which is very significant because if you have been following the issue of youth tobacco use and youth vaping, it really skyrocketed over the last few years. So to see any downturn at all is really remarkable. Now, beyond this data point, which is from the National Youth Tobacco Survey, there was another study that came out in partnership with Stanford, looking at young people's e-cigarette and vaping use. So down at the bottom, you'll see among young people under 21, so specifically underage youth, about 2/3 of them who said that they had changed their e-cigarette use said, I quit or I reduced it. However, there were some who reported increasing the dosage, so increasing the amount of nicotine or THC that they were taking in using these vaping devices. So it's not all good news. There is some mixed news there, and we'll talk about some of the kind of high-level reasons for why students might be increasing their use in a minute. However, we do have to also address the youth opioid overdoses. So this is from the California Opioid Dashboard, which you can access. You'll have access to all these slides, and all of these links and sources are clickable. You see, unfortunately, there toward the end, there is a large spike. This is for 15 to 19-year-olds, the rate of opioid overdose deaths here in California per 100,000. Now, you do see a spike for many other age ranges, unfortunately. So looking at this figure and contrasting this with the decrease in tobacco use, it's reasonable to infer that a very high-risk group that we need to be monitoring and looking at and providing additional supports for is young people who are currently using or in recovery, because you might see a lot of relapse and spiking, and that might be contributing to a lot of these opioid overdoses. So pulling back for a second and thinking just broadly about the big picture here of COVID-19 and substance use, youth substance use to be specific, the sort of good things that are happening are that there is a reduction in the access to substances, right? Whether they're being obtained formally at school or formally out there in the community or at parties, right? A lot of that is not taking place now. And you have this decrease in some of these negative social pressures, right? If young people aren't at parties, they're not being exposed to all of this pressure to fit in and to use substances as a group activity. And also those social triggers for folks who are in recovery, they might not be exposed to that, which is good. However, the other side is that there's all of these incredible stressors that we're going to talk a little bit more about in a minute that are creating all this negative energy for young people, which may drive them to use substances as a coping mechanism. And then you pile on top of that isolation from all the positive social supports, whether it's their peers or trusted adults. So really there are these pros and cons about what's happening around young people and substance use. And lastly, there at the bottom, I think it's also very important to consider the impact of parental substance use, right? Even if we're not talking about the young people who are using themselves, so important that we remember that family substance use can really drive a lot of those cycles that we mentioned earlier, and all of those, the discussion of involvement in the child welfare system, abuse, neglect, trauma, family economic hardship, right? all of those factors so closely tied into parental substance use. So remembering, maybe we need to keep an eye on the youth substance use, but also on that of adults because of this factor. And with that, I'm going to pass it over to Stephanie, and she's going to begin talking a little more specifically about the mental health landscape and how that has changed.
Great, thanks, Stephen. Yeah, so looking at the mental health landscape as it relates to COVID-19, we're seeing numerous mental health implications, some of which include the onset of stress-related disorders, exacerbated mental health conditions, increased use of substances to cope, and observed rise in suicidal ideation. I apologize, for some reason this is not advancing. Stephen, can you help me out? Thank you. So all of these things are incredibly concerning, of course, but certainly even more so for our youth and more vulnerable populations like CSEC in this ongoing crisis. And much of my career has been focused on crisis intervention and postvention efforts. And one of the most important questions we ask in crisis is who is being impacted, right? And to what degree? And in the case of COVID-19, the answer is everyone. Every single one of us has been impacted by COVID-19 in some way, shape, or form. And you know, we do see variations of that impact across generations, but what we're seeing is higher proportions of stress relative to prior years across all generations. This is reflected in the American Psychological Association's APA Stress in America report for 2020. And as of August, months after the initial onset of the pandemic and weathering this new normal, many were struggling to cope with the disruptions it caused and reported high levels of stress. And what we know about prolonged elevated stress is that it can contribute to toxic stress, which can have negative implications on our physical and mental health, not only in the moment, but for years to come. We can see that variation in impact across generations in this data set here. And in older generations, it seems that they were coping more effectively. But for Gen Z adults, so that's ages 18 to 23, they were definitely having a more difficult time. And factors contributing to that stress is that these young people are entering adulthood in a time that feels incredibly uncertain. This is a time where these youth should be feeling like they're at the beginning of their lives, the precipice of what could be, right? This hope, this excitement. And it seems that there's kind of this dark cloud of uncertainty looming over them right now. But we also have to pay close attention to our younger children and adolescents, especially for us in the education sector. And so this is from the This is from the CDC. It's a weekly proportion of mental health related emergency department visits for children under the age of 18 in the US through January and October 2019, which is the solid line, compared to 2020. And at the beginning of April 2020, the proportion of children's mental health related ED visits among all pediatric ED visits increased and remained elevated through October. So compared with 2019, the proportion of these visits among our children ages 5 to 11 increased approximately 24%. And for those 12 to 17 years of age, we saw that rise about 31% respectively. And we know after October, at least here, right, we had a number of additional stressors: the election, new variants of the coronavirus, the vaccine rollout, reinstated restrictions and lockdowns. And so these could have continued to elevate. We just don't have that data yet. But really, these findings provide us the initial insight into children's mental health in the context of COVID-19, and really highlights the importance of continuing to monitor our children's mental health, their connection to care, support, and building resilience among children and families, because we're not quite out of the woods yet. I think a lot of us are kind of seeing that light at the end of the tunnel, but we're not quite there. And, you know, everyone responds to stressful situations differently. I was speaking with a colleague recently about this. Actually, we were talking about this need for increased empathy, understanding, sensitivity, support. And they said to me, you know, we're all in the same storm, but we're in different boats. And that really stuck with me. The impacts of this crisis are going to vary widely, because the factors that contribute to our situation and ability to cope are incredibly diverse. And so some things that we have to consider, right, are things like this: your background, social support, financial situation, emotional and physical health, as well as the community you live in, access to resources. All of these things are so important for how we are going to navigate this. So we're all weathering the same COVID-19 storm, but no two people are navigating it in the same ship. And especially for those of us in education or who are working with youth, we have to look at the whole child by considering all of the systems that are contributing to their experience and well-being, and ensuring that we're engaging in trauma-informed practices, which have never been more important. Even before COVID, an estimated 72% of children and youth in the United States were experiencing at least one stressful event before the age of 18. And so we know now that is going to be elevated. And childhood trauma can have a lasting impact. It can increase risk for psychological, behavioral, emotional problems, things like depression, PTSD, substance use, decreased academic success, social maladjustment, poor medical health, and so on and so forth. And so we have to be hyper aware of the risk factors for trauma and make sure we are increasing protective factors, especially when it comes to trusting, nurturing caregivers, quality connection to trusted adults, and safe, stable environments. All of these risk factors stand out really to me right now, especially family stress, right? Or loss or fearing the loss of a loved one. Parent and caregiver substance use and mental health conditions, right? These things are really, really contributing to our youth's stress, but limited social support and isolation is a huge one. And actually, studies are showing that loneliness is associated with adverse mental health in children and adolescents. And while we have limited evidence on specific interventions to prevent loneliness or reduce its effect on mental health during this time of involuntary social isolation among our youth, there are strategies that can help promote more positive mental health. Things like maintaining the structure, quality, and quantity of social networks, finding ways to give children and adolescents a sense of belonging with their family, their school, the wider community, helping them identify who they can look to for support. But I think it's really important for us to realize that simply increasing the frequency of connections is not necessarily going to be effective in addressing youth loneliness. It's more about that quality of connection and helping young people to identify valued alternative activities and helping them build structure and purpose. And so we have to be checking in with them, right? We have to be asking them and helping them explore new ways of that connection and asking what feels like a quality connection versus what does not. This is a critical time to be evaluating youth voice and kind of bringing them to the table in order to better understand the challenges that they're facing so that we can have the right information to know how to help them navigate this experience moving forward. And the Youth Truth Survey did just that. This report shares data insights gathered from the Students Weigh In Learning and Wellbeing during COVID-19 survey. Over 20,000 students responded to this, over 166 schools, 9 states. And here are some of those key insights that we found. And about half of students related their relationships with teachers and adults positively. Only 1 in 3 students said they really feel like they're part of their school community. And the most frequently cited obstacles to virtual learning were distractions at home, 54%. But the more concerning one to me, this last finding of most frequently cited obstacles to virtual learning included 50% of youth feeling depressed, stressed, or anxious is particularly concerning to me, especially because I have the great privilege now of working in a prevention program. We're supporting youth in finding voice, right? And giving them choice in bringing mental health awareness to their school campus. And one of the things we do with our student advocates as we start working with them is we provide them with a mental health 101 foundational workshop. And in that workshop, we ask this question: what do you think of when you hear the words mental health? And I actually invite you now to put this in the chat box. What do you think our youth are responding with when we ask them this question? I mean, you could even answer it yourself. What do you think of when you hear the words mental health? But I'm very curious to know what people think our youth are saying or responding, how they're responding when they hear this. So stress, okay, perfect. Self-care, stress again, therapy, stigma, crazy, depression, taking care of how we feel, state of mind, wellness. Okay, so some of you are right on the money and others are a little more optimistic, which I really, really appreciate, absolutely. But these are the things that we are seeing come up when we ask this question. So certainly there are some things that come up that are positive, but we're seeing more of these negative connotations connected to mental health. Things like not opening up, stigma, instability of emotions and feelings. It's not real. I'm drowning. something's wrong with you, you're making it up. So this is very concerning for me. While we're up against many barriers in providing access to mental health services for our most impacted populations, which is obviously youth, one of my greatest fears is the stigma that contributes. Right now, the delay between first symptoms of a mental health condition, 50% of which begin by age 14, 75% of which begin at age 24, to the time that they're accessing treatment is averaging 8 to 11 years. And we know the longer it takes for an individual to get that treatment, the more severe a condition can become. So I guess my call to action here for all of us is to continue providing access to services, right? But also offering more opportunities for quality connection and focusing on breaking that mental health stigma so that we can normalize these conversations about it and help our youth who are going to be facing mental health challenges after this difficult year so they can get help as soon as they need it.
Thank you, Stephanie. And thank you everybody for continuing to participate in the chat. I really appreciate all the responses that are coming in that absolutely are validating what we're discussing, and that we all have this shared perspective and shared experience about what is going on with our young people. So briefly, we want to talk about some of these high-level interrelated issues that are affecting some of these risk factors nationwide, but I mean, throughout the world. We do have some specific data for California. And increasing economic hardship is really one of those cornerstones that is going to have a tremendous impact on trafficking, but on a number of factors. So looking at California, this is from the Household Pulse Survey from the census, and this was of March, so this was the latest data I could get. 1.3 million Californians right now are not current on their rent or mortgage payments, or they have slight or no confidence that they're going to be able to make their next payment on time. So imagine the toll that that takes on your mental well-being. And then 10.3 million Californians say that they're expecting someone in their household to have a loss of employment income in the next 4 weeks. So thinking about economic anxiety, thinking about what impact this is going to have, but also thinking further down the line that housing insecurity, according to the Polaris National Human Trafficking Hotline, many of the cases that they have seen in this era of the pandemic, housing insecurity has been a major risk factor, losing their housing, absolutely. Now, this is the data here also reflects our thinking that economic hardship can lead to mental health symptoms. So what you're seeing here back in July is the green bar is the number of California adults in this survey who reported mental health symptoms. Then over on the right, those 3 dark blue bars are showing higher rates of reporting mental health symptoms among those, again, struggling to pay rent, having low income, or not having enough food to eat. So you can see a very clear relationship between economic hardship and poor mental health outcomes, which then again leads to our human trafficking risk profile. And then accessing services has changed a lot as well. I'm sure you are all well familiar with the shift to telehealth that virtually all healthcare providers have taken. On the plus side, that's allowed access to a whole lot of people who previously may not have felt comfortable walking into an office to address their health concerns or mental health concerns. And it's driven a lot of innovation. But there are some downsides here. So number one is that peer support. So in speaking about substance use, right, 12-step groups, that sort of thing, they have taken a hit because of what has happened with the pandemic and needing to stay safe, and that not everyone has even access to telehealth. As we in education have understood, we have major equity issues for students to be able to access distance learning. The same applies to telehealth. And if you look over on the left-hand side, this chart is showing that the blue bars, the dark blue represents having a computer in your household, and the green bar is you have high-speed internet in your household. You can see differences there among persons reporting that they have private insurance, Medi-Cal, Medicare, or are uninsured. And actually the lowest percentage of people who report having access to that tech are those who are on Medicare. So imagine you have an entire family and you are struggling with income and economic insecurity, and your kids are all trying to share the same Chromebook on the same slow internet access, and now you're going to try and set up a Zoom appointment with a mental health counselor. And these are real issues that so many people are facing that are really remain to be addressed. And then relationships and youth safety. This was touched on earlier, but I do want to circle back to it. and that it's really limited the contact that young people have with trusted adults, whether it's teachers, coaches, mentors. It's really cut those off. And so as a result, we can miss a lot of the red flags. As was mentioned earlier, child abuse reports have plummeted. That you'll see this chart on the left is indicating between October and October, that severe decrease in child abuse reports. And you'll see down below in the red, that's among education reports. So many of those reports that come in from the education sector now are not happening because of distance learning. And parents and caregivers also are wearing many hats, and so they may not be able to pick up on red flags of maybe young people being recruited over social media for human trafficking. And with that divided attention as well, and this isolation from other trusted adults, not only are we missing red flags, we're missing out on opportunities to develop really deep connections, trusting relationships with young people that can help them to develop the resilience that they need to emerge and thrive throughout this period. So then how do we do that? How do we build this resilience among young people? So we're going to talk about some specific strategies and resources that you can take back and use in your work with youth to help build that. So in thinking about resilience, maybe we can break it down into a few key components. So that those strong relationships, right? Having this mindset of hope for the future, and then having tiers of resources and supports for young people when they encounter problems. What is there to support them? What is this network that they have? So this is a new resource from the AAP, American Academy of Pediatrics, called Building Resilience in These Uncertain Times. And this is actually for parents and families. And it helps us kind of reflect on our own thinking and struggles that we may be having during this pandemic, our own struggles, and then how we can channel that thinking into dialogue with our children. And you'll see here the power of reframing. This is one of the points that they try to emphasize, is that we can create teachable moments and really empower young people to build their own resilience and ways of thinking by doing things like this. So our autopilot responses sometimes when young people express concern can be, oh, I understand. Whereas it might be beneficial to think and say, hey, help me understand what you're going through. And let me help you with that. Of course, it's so easy for us to jump to immediately, right, when a young person's in trouble. But then flipping that to, how do you think that you could solve this problem? Obviously, not a perfect, this won't work 100% of the time, but really encouraging that mindset of moving from autopilot to empowering and working with young people to develop those skills. And now I'll pass it back to Stephanie to talk about a few more things.
Yeah, so in addition to reframing, which is so important, there are other things that we can do to ensure that we're continuing to build that resilience with our youth. One of which is creating structure and routine. But for right now, we have to really allow for flexibility. So the only constant we've had this year is uncertainty, right? Things are ebbing and flowing and changing. And so we have to be able to shift and create new routine, new structure when those things happen. But be flexible with the needs of our youth. Reducing exposure to media coverage and modeling healthy consumption. I don't know about you all, but I have been glued to my phone this year with all the new headlines and guidance, and I always want to be in the know. It's important to be in the know, but honestly, I think our youth are going to do what we do, not do what we say. And so if we can model healthy consumption, we are going to have a far higher chance of them replicating that and making sure that they are not consuming too much of that media that could induce that stress response. Offer opportunities for expression and sharing. And this doesn't always have to be, a long conversation. This could be a quick talk in the car. It could be watching a movie together and having a more organic conversation. It could be activities, playing games together, right? There are ways that we can do this. Promote healthy coping skills that support physical and emotional self-care. Are you getting out for your vitamin D? Are you taking regular walks? Are you stretching? Are you doing things like eating healthy? These seem like the basics, but I think we have to go back to the basics when we're going through something so high level as an ongoing global crisis. Provide opportunities for engagement and connection, like we talked about earlier. That's really important, and exploring new opportunities for our youth that they can engage with that may be different from what they look like before. And then build and strengthen trust through support, understanding, and patience. Not always easy, especially because we're going through this as well, but so important if you want to build that trust especially so that our youth feel more comfortable in telling us when something's going on with their mental health. Even if they can't put the right words to it, they could have the conversation that something's off, which is what we want so badly right now, to ensure that they get connected to the support that they need. And in the next slide, in response to the coronavirus pandemic, a lot of disaster psychologists are pointing to psychological first aid as an effective intervention to help reduce distress. And so again, because of the uncertainty and this ebb and flowing and kind of this roller coaster that we're on, this can be a really good intervention for you to invest in if you haven't already gotten this type of training before. It's evidence-based, it quickly helps calm folks down, it's trauma-informed, and it can help improve mental health. So there's a number of ways that you can get this training that are low cost or no cost. One is through the National Child Traumatic Stress Network. They have an online forum where you can take this training, the Red Cross, and I believe the APA as well. We can include those resources for you all in case that is something you're interested in. And then we think it's really important to ensure that we have not only resources for our adults, but resources for our youth as well. So we always think to the bigger resources, right, to help us out. But for youth, those youth-centered resources that they can lean into when maybe they aren't comfortable with talking to an adult or they just need a little supplemental support are going to be super critical. So National Suicide Prevention Lifeline, always a great one. Crisis Text Line, Trevor Lifeline, which is LGBTQIA sensitive and understanding, which is important for a lot of youth. GritX, this is an evidence-based online application. So it's app-based, it's also web-based, but it was created by UCFS clinicians, which is amazing. It's super interactive and engaging and has a lot of great tools to support mental health. And then finally, know the signs, because we want our youth to be prepared to know what might come up in themselves or their friends or their classmates, and be able to reach out for the right help. I think I have one more slide here. Yep. So mental health resources for you all. So finding a healthcare provider or treatment for substance use disorder or mental health can be found on the following links. Again, we have this in our Whova. You can go ahead and click on these links in there in the slide deck if you are looking for how you can get in touch with a mental health provider and start getting some services if that is something that you need or your youth need. And I will say too, if you have a health provider or insurance right now, you can always do that through your insurance website as well. There's also some resources here for adults on self-care and coping. This is important for our youth, but it's just as important for us. So the National Child Traumatic Stress Network put out this Pause, Reset, Nourish. It's a one-page quick resource, very direct instructions on how we can make sure we're checking in with ourselves, resetting, nourishing ourselves so that we're giving folks the best of us, not the rest of us, right? ACEs Aware has a self-care toolkit for adults, which is fantastic. And then the Center for Disease Control, they're coping with stress, just some different strategies that you all can use as well.
And then there's one more resource for stress that actually our California Surgeon General, not Attorney General, our California Surgeon General, Nadine Burke-Harris, also well known around work on ACEs, actually put out a specific guide around dealing with stress in a time of COVID. And I think we'll find the link and plug that into the chat. I just remembered.
Yes, that is the playbook for stress caregivers and kids during COVID-19. And yeah, we will make sure that that is available for you as well, because that is a great resource too. Thanks, Stephen.
Absolutely. So finally, one last resource that we want to share with you is the Reset Toolbox. And this comes from a partnership with the leadership of the Western Youth Services, a local organization here, in partnership with us at the Orange County Department of Education, the Children's Hospital of Orange County, and many other experts who have provided a number of free trainings, self-paced courses, apps, videos, all kinds of resources for parents, families, for community members, for educators, all sorts of folks to build resiliency in young people, to build resilience. And so you can check it out at resettoolbox.com and enroll in some of the courses, download some of the apps and videos, and check out some of the free live trainings that are occurring through that as well. With that, we do want to, again, close with a hopeful message with the help of the voice of some of our students, and keep our eye on the future. So this comes from a local high school from El Dorado in Orange, and they put together this film for the Directing Change project. So let's watch.
The saying, you never really know what you have until it's gone. During this time of crisis, there's no school, jobs are exploited, hangouts are canceled, sports are delayed, and travel is paused. Sometimes it takes the times like these to help recapture that perspective of what we previously experienced and had. During these dark moments, you have two paths. You give up or you have hope. It reminds us that sometimes it doesn't matter how we spend our time, but with whom we do. It reminds us about the promises of tomorrow. One day we'll look back at this moment with the things we've learned and the hardships we faced, and be reminded of the strength of the human spirit. In times like this, it's hard to be optimistic, but if we look hard enough past the fear and uncertainty, there's something to be gained. That little glimpse of hope will eventually light our way and be a road to tomorrow. Hope is the one thing necessary for life. Have hope in yourself, your family, friends, neighbors, medical workers, and political leaders. Everything will be fine if you have hope for tomorrow.
So thank you for watching. And as we sort of close, we wanted to leave you with this. If maybe you would like to participate in the chat, this is an activity called Suit Yourself, which comes from the Social Emotional Learning Playbook. And this, if you, in thinking about what we've shared in this presentation, is there something that you want to keep digging into and learn more about? Is there something that you felt that had an emotional impact on you? Is there a gem that you're going to take from this presentation that's going to be valuable for you and your work? Or maybe was there a thing that grew for you, whether it was an idea, a thought, or a point of view? So if you wouldn't mind one last time indulging us to share anything that came up for you within one of these categories in the chat, we would really greatly appreciate it. And thank you so much for your time and attention. We'll move on to our Q&A now. Thank you.
Thank you so much.
Thank you, Stephen and Stephanie. Always a great presentation, and we have all kinds of stuff happening here. So I'm going to jump over to the Q&A. There was a specific question back when you first started introducing statistics, Stephen. And it said, the question was, is there a breakdown by race or area in which there's a higher usage or lower usage, I believe, of tobacco or opioids?
I'd have to go back and, oh, sorry.
No, go ahead.
Yeah, I'd have to go back and look at some of the specific data sources like the National Youth Tobacco Survey. The opioid dashboard does have some level of disaggregation, so you can break it down a little bit more than what I presented. But again, there's all sorts of caveats as well when we start looking at different populations and different areas. But let me go back and check on that.
Okay, great, thank you. Next, some young people almost seem to enjoy their mental health symptoms on their social media platforms. It's almost like a celebration, right? They're kind of, in a way, they throw around terms that they have not been diagnosed with, or just throwing around terms in general. How can you differentiate the people who need help with people who are just throwing around vocabulary?
Sure. I think one of the things we also teach our youth is there's really no such thing as like they're just doing it to get attention, right? They're just faking it. We want to take all instances, all conversations, all posts seriously. And so I would say that might be a youth trying to explore what they are feeling. They're trying to put a name to that emotion. And so if I saw that, I would definitely have an extended conversation with that young person about what they think it means and maybe if they've been feeling that way.
Great. Here's a request, and I'll let you can answer it as you choose, right? So everyone loves your presentation. I can say that. It's repeatedly been mentioned in both the chat, mostly in the chat, but this person asked if they would be able to use your presentation, share your presentation with their youth pastor, and if that would be okay with you for people who didn't have a chance to participate in the Ensure Justice program. How do you feel about that?
Stephen, I'll defer to you.
Sure. I mean, I have no objection with the information that's being presented here, being shared far and wide. I have nothing to hide. I guess my only word of caution would be to ensure that it's contextualized appropriately and that folks understand some of the numbers that they're looking at. And really the approach that we take, particularly when it comes to youth substance use, we want to ensure that we're not inadvertently stigmatizing. Like for instance, when we talk about marginalization and particular groups being maybe what the term sometimes at higher risk of trafficking or substance use or mental illness, we want to make sure that those are presented in a way that's not going to create assumptions for people. And so we always have to move very delicately when discussing the subject matter and in a way that's trauma informed. We wouldn't want to expose folks to some information if they weren't properly kind of warned and prompted that some of this is very sensitive in nature.
Yeah, and I would say that's safe with any kind of statistical, any kind of statistics you use. You got to be, I tell people all the time that numbers are great, but they can prove the positive and the negative all at the same time.
Right.
And you have to be super careful how you apply them. And every context, every situation, I went state to state, and it seemed almost every time I used a number, I had to be very careful how I applied it in every context. Every city seemed to have a different way of applying it. So I would definitely caution and make sure. And I've used other people's information in my presentations, and I'm really careful to make sure I give credit where credit's due. And people put a lot of time in their presentations, organizing them, and I think it's only fair that you give them the credit that they deserve to take the time to organize all that information that's out there into a cohesive, presentation. So I would just encourage you to do that as well.
Sure. Oh, and the only thing I would say too is like particularly the resources toward the end, they should have absolutely no qualms about sharing out. Like that's 100% fine. All of those resources that are out there to support young people and adults, please share all of that. That doesn't require any prompting necessarily.
Sure. Yeah, that's all for fair. Someone's asking if there's any research. Obviously, you're focused on education, a more secular focus. But are you familiar with any kind of research that has a relationship between communities and religion and resiliency? And how religion may figure into resiliency, how it may reinforce or undermine resiliency.
Sure. I mean, well, I'll pass it over to Stephanie after this, but I used to work for a project that called Faith in Youth that was supporting faith-based youth groups with their positive youth development programs as a protective factor against substance use and protective and encouraging pro-social activity. And so there is a lot of merit to the idea of encouraging young people in their faith-based settings to be performing acts of service and developing morals and values and to also developing their social skills with one another. And so building a community and having a trusted adult outside the home whom they can confide in and share their concerns about and who can model some of these social and emotional skills for them can be tremendously powerful. And so when you look at models like the 40 developmental assets, which span across not just secular and educational areas, but faith-based organizations as well, there can be a lot of merit to that. As you mentioned, every faith-based community is different. They have different values, they have different beliefs. But I think that having worked in interfaith settings for a long time, you can really find common threads very easily around supporting young people, supporting their well-being, and supporting them as a faith community. So Stephanie.
Wow, that was a very good answer. I don't have much to add. I don't have specific research that I can pull from per se, but something that we would do in crisis intervention all the time when we would go out to schools impacted by crisis is we do ask our students, what are the things in your life that are going to help you cope through this? Who are the folks you can turn to? And a lot of times we do hear things like their faith or their pastor, their youth pastor, right? And so we want to lean into those things that make them feel more connected and supported because it will help them through something difficult like this. And so I think absolutely that leaning into faith right now, if that is something that is helpful for our youth, we want to encourage that absolutely.
Thank you. And honestly, even in the police departments, I mean, especially in crisis situations with, crimes against persons, when you have assaults or when you have sexual abuse, gang involved shootings, tragedies in family with car accidents or sudden deaths, things like that. We would incorporate the use of pastors or other people of faith in our responses to help the family, because in those are times that any kind of family resiliency, personal resiliency is always tested. So there's always that element in a lot of different ways you can respond to families and individuals as well. Another question, do you use different intervention or educational approaches based on the cultural background of the youth that you're working with?
Stephen, I will defer to you.
Yeah, so I mean, of course, not one size fits all. There are some skill sets that really research has shown to apply across lines of cultural heritage and demographics and all of that. But really, I mean, coming back to the idea of empowering young people, we love to work with youth who represent the diverse coalition of students throughout Orange County so that they can be peer ambassadors, because no matter how much research we do or how much we think that we can understand the experiences of a given community, whether it be Hispanic, Latino youth, whether it be LGBTQIA youth, we can make assumptions and look at the data, but really young people understand best what is going on in their communities, and they can speak truth to power, and they can understand, how will I be able to reach my peers with the messages that matter. So whenever possible, we do try to encourage peer-to-peer education, of course, relying on these general sets of standards and practices that we have across our prevention and interventions.
Thank you. Coming your way, Stephanie, how can we focus on our mental health in a responsible manner where we can ensure that we are effectively helping others to the best of our ability while still taking care of ourselves concurrently?
Yeah,
you mentioned it a little bit, but
it's a tall order right now.
Yeah, yeah.
I want to extend my empathy and understanding and just sensitivity to everybody right now who is wearing 20 hats. We are all wearing 20 hats, and we're all doing it in one space at home, right? And it's difficult. And so certainly I think that we have to, again, step back and look at the basics. Are you eating well? Are you getting some exercise? Are you making sure you're getting out of we're all stuck on Zoom all day long. And there are benefits of that, certainly, more connections worldwide, that's fantastic. But if we are not getting out of our little box every day, and shifting and changing our mindset and getting some vitamin D and doing those basic things, it is going to impact our mental health in a negative way. And also it's not, I think a lot of times people think like self-care is a spa day, right? Which that sounds amazing. But really what it is that 20 minutes a day that's just for you. It can be 10 minutes, but it's something that you have to reconnect with yourself and find out what helps you recharge. Is it music? Is it journaling? Is it, a quick walk around the block? Is it a breathing exercise? You have to do some exploration to figure out what that is, and then make sure you're scheduling it in and prioritizing it so that you can be refilled as you continue to support others. No easy feat. I'm still working on it every day, but that's the important part, is that we are working towards that.
Well, I think you're special if you can only do 10 minutes and be recharged, Stephanie. I'll tell you that right now. I need a little bit more than that, so good for you. Stephen, is there any research on where young children are getting access to these opioids during this, kind of lockdown, isolation timeframe that we've been having here during our COVID-19?
Yeah, I haven't seen specific reports on the sources there, but generally, even absent a pandemic, a large amount of access to prescription opioids and medications in the home is from the medicine cabinet. It's diversion of extra medications that have been, prescribed legitimately to a family member that have sat around in the medicine chest because we don't want to get rid of them. I mean, we went to the doctor's appointment, we went to the pharmacy, waited in line, paid a $50 copay. I'm not throwing out my leftovers. So unfortunately, if you don't secure your medications in a locked place, or monitor how much is left, or destroy or dispose of the excess medications, it can serve as a source and an introductory source as well when young people become curious. So that would be my primary word of advice, is to prevent that diversion, is to secure, monitor, and destroy those medications.
Stephanie, do you have any more to add? Because and I would agree too, because I would say that I think we frequently overlook prescription medications and especially leftover prescription medications as being a source and a sustainable source for people to continue to use opioids. Because I think a lot of people, when you hear drug abuse, you're thinking of people getting shot up with heroin and, you know, the typical, you know, dramatic, you know, 1 hour TV show where people get overdosed. When in reality, it's a lot of the pills that are being really the culprits of this. So.
Absolutely. And if folks are interested in sort of this whole conversation around the use of opioids and whether it's right for you or wrong for you, the Orange County Healthcare Agency has put together a website called Wrong for You. I believe it's wrongforyou.org. And it's sort of an exploration of the opioid epidemic and its effects on particularly our middle-aged population in Orange County, and then what we can do about it as a community.
Thanks. Yeah, I agree. I think it was a wake-up call to me as a younger officer to see because again, I walked in, I was 25 when I became a police officer, and to see, and I still had in my mind, junkies and the whole, kind of media, movie kind of mentality, and to realize it was really prescription medication left over from grandma and grandpa and older parents who were really causing a lot of that childhood kind of, like you said, entryway, as well as sustainability. That was really a shocker for me. Stephanie and Stephen, and then we talked a little bit about this, but regarding isolation, what are some more practical steps youth could take during self-isolation or quarantine that would encourage more positive mental health, for them during this time? And we've talked about adults, and self-help, but what about for the kids?
Yeah, this has been really hard with school closures, distance learning. School used to be a place where a lot of students felt connected. That's where their peers were, trusted adults were. And so certainly the barriers this year have been immense. I will say, you're seeing more and more programs, more prevention programs around mental health and engagement coming through. Things like Directing Change, which we saw that video by that young person. Such a great video, right? I could not believe it. I can, because our youth are awesome, but certainly this was a great way to get students involved with a project that not only helps them to have some kind of creative outlet during this time, but also for that deeper level learning about mental health, which we so deeply need because of that continued stigma. But there's other things as well. And I would encourage folks to reach out to their school communities, whether that be through the principal, the school counselor, school psychologist, district personnel, about what they're offering to their youth as far as engagement opportunities are concerned, because there are things out there. There are also opportunities through the Orange County Healthcare Agency, Orange County Department of Education, and we'd be happy to engage in giving folks different ideas dependent upon what might work best for their youth. That's the other thing. Stephen said earlier, there's no one size fits all. So we have to also be exploring those opportunities and giving youth the opportunity to participate, and then seeing if that is something that actually connects with them and makes them feel like they're part of a group, that they're part of something bigger, giving them purpose, giving them that engagement and connection. But not everything fits for everybody. I also think offering them those different resources we had, the youth resources, is really important, and exploring those with them as well. I don't necessarily know, and they're all app-based, you can text, right? I know this next generation doesn't necessarily like to call or go on websites, but there's something that's focused for them. And so if we can help explore that, put that in their phone, save it, put it in their web browser, whatever that is, so that they know it's there. I think that's another step towards making sure that they feel connected and less isolated.
And I just dropped in one of the self-paced courses. I mean, it's really not going to be super academic. It's very informative, but don't be scared if you're sending this to young people. It's from our Reset Toolbox our colleagues put together, called Connectopedia, and it includes, of course, some digital citizenship aspects about how to stay safe and stay positive online, but as well as how to build connections with your peers and maintain good mental wellness. So there's like a virtual self-care room. There's all kinds of mindfulness techniques, different things that they can use in there. Very practical, very straightforward, so they can check that out as well.
I appreciate that, Stephen, for that plug. I actually helped work on the mental health section of that portion, so I appreciate you. And yes, please check it out.
Deputy in charge. There we go. Last question for you. So there's a question basically asking, do you believe it's, what would you give more weight to if there's such a thing? Would you give weight to a weak or non-existent family units? Or would you give more to institutional oppression when it comes to contributing to youth substance abuse? What do you think is more of a factor in contributing? Or do you think it just depends on the individual?
Well, a lot of things depend on the individual, but this is a
Sure.
very interesting question because I do hear these perspectives come up a lot about, which comes first or which matters more. But in reality, when you look at the family unit and then you look at institutional oppression, the two are inextricably entwined. One cannot exist without the other. The reasons for mass incarceration and the reasons for marginalization are entwined within our families, become very generational, and that the cycles that we showed earlier, they are all one big messy web, which we have to dismantle one leg at a time. So it would be, it would be mildly oversimplistic to say that one matters more than the other because the two are really two sides of the same coin.
Stephanie, you're on the same page. You're nodding your head, so I'm gonna guess you're on the same page.
Yeah, absolutely, I'd agree with that 100%.
Hey, so both of you, thank you so much for your insights and for sharing your experience and your education experience with us. Everybody, thank you so much for spending the time with us. You have a 15-minute break, and then you have some workshops to experience for the next hour, where we even dive deeper, if that's even possible, but it is, into a lot of different topics. And we have one more plenary to come. I want to again hope you keep enjoying Ensure Justice 2021. We have a lot more to go, and we have even another day after this. So strap in. Well, actually, don't strap in. You want to unstrap yourselves right now, take a quick break, maybe get some drink or food, take a bathroom break if you need that, and come on back in 15 minutes. More to come. Thanks again. Talk to you soon.